This is Billy Reed, and I'm Lynn Crofton.
And tell us a little bit about yourselves.
Billy actually had a brainstem stroke back on April 1st, 1998. It's been about 15 years. And we've been at home now for 13 years. That means that he gets good care at home. He's got great skin, for example. He stays healthier longer. He doesn't seem to get as sick anymore. And, you know, we can do a lot more here than what we were able to do in a facility, even personally for him. It also takes a lot of the stress out of running back and forth to a facility every day. It is a third full-time job. I mean, you got to keep the house running, you got to keep the meds going, you got to. It's a big schedule. Sometimes his schedule's a lot more busier than mine. But it's just good to have him healthy and still with us. Well, he uses a ventilator, a coughilator, an oxygen concentrator, a chest PT vest to help keep those lungs clear because he does have diminished lung capacity. We have a nebulizer to keep giving him the treatments to keep the lungs going. We have a, what else? We have suction machines. We have a Hoyer lift, we have a Stand-Aid.
Lots of different things.
Yeah, it's a hospital bed, nursing table, I don't know.
Can you-
Lots. He requires a lot, but I think it's all worth it. In my right hand, just like the home health aides. I couldn't do this alone. So if we need equipment, it's not like I can even run and go get it sometimes, but everything seems to malfunction at the worst possible time. So we really need to have them on those 1-800 numbers where you can call them around the clock in case there's a real emergency, because if they're not able to facilitate the needs for the equipment, I have to bring them to a hospital. We use two, one for like real medical equipment and one for medical supplies and medical equipment. With the medical provider, it's been years and it's been good, and they provide the respiratory therapy support as well. As far as the medical equipment and stuff like his wheelchair and his leg brace, we had been working for a very long time with one vendor, and unfortunately with some changes in the healthcare rules, laws, whatever, last year, we needed to repair this wheelchair, and the current wheelchair that Medicare provides is not as good as this one. And the vendor we were using was no longer participating, so they were out, and we had to bring in a whole new vendor, and it took over a year to get his wheelchair fixed and repaired to be safe for him. And I thought that was way, way, way too long. Right now, I think that they're doing a really good job. I see something changing because it's not the same day anymore. And I know we were just talking earlier about like the pulse ox is malfunctioning, and when we turn on the oxygen concentrator, it alarms that it needs service and you got to shut it off and turn it back on. So it makes you wonder if it's truly working to the way it's supposed to. And it's been a week now since nobody's gotten here. Well, from what I understand, the government is interested in reducing their rates and, you know, their expenses, so I can understand that. But sometimes quality care, you know, you can be penny wise and pound foolish. So you could buy, you know, this sponge, but if it's not going to be absorbent, you know, you might as well stay with what you have. So it's going to impair the ability to provide the care that we need to provide to our loved ones at home. I think we need to not forget that the people are home and that they need this care. It's not like I buy a bottle of milk, or do I buy the store brand, or do I buy the name brand? I mean, it's about the same thing when it comes to milk, but when it comes to quality care at home, there seems to be some larger discrepancies that really could get in the way of the person's ability to live a fruitful life.